what we do in Colorado, and Team Select participates in this with a lot of other great companies, is we take parents and family members of medically fragile children. We train them for free at no charge. We put them through at least 80 hours of classroom training, 40 or more hours of hands-on clinical training, and we actually get them certified as certified nursing assistants or certified home health aides. And what we do is we take either the lower acuity children, maybe children without a trach and vent, and through Colorado's innovation and really tackling this problem in a practical way, we train those parents, and essentially we train, and those parents become a member of a home health company, a clinician, just like another nurse would be, and essentially they get paid to perform nursing duties. They don't get paid to be a parent. They don't get paid to tuck their child in or cook them breakfast. They get paid to take on the lower acuity duties that are frankly well below a nurse's educational level. The things like the bowel care, the G&J tube feedings, the bathing, the activities of daily living are very medically appropriate to delegate to a CNA or home health aide, especially in light of the nursing shortage and crisis. And so what happens is, we see almost every day, we're taking single parents in Colorado and of course married ones too. We're giving them free training for the country's fastest growing job. We're giving them a very fair living wage. If they work more than 30 hours a week, they get a full benefits package for them and the entire family. In a lot of cases, we're taking parents off of food stamps and welfare and giving them a middle-class job, and really giving them their pride and their dignity and taking control of their life back. And at the same time, we are taking those valuable nurses, and instead of having them work below their license level, we're able to pay those nurses more and really focus on the higher acuity cases, the trach and vented children, and have them work at the higher end of their license and free them up to become case managers, clinical supervisors, and actually provide a career path and allow them to help multiple families. And this program in Colorado has driven what we've seen as an 80 to 95% reduction in the hospitalization of these children, because what happens then is a parent or family member never misses work, they never call in sick, they're always there, and that child gets that care plan, every element of it executed every single day so that that child remains stable. It's when there's those gaps in care and there is no nurse that doesn't show up for a week or even a day, and you have a parent scurrying, unsure, untrained what to do. And so what we find is, we're saving the state of Colorado, us and our other advocates and allies that provide this type of care. We're saving the state about 30% on every hour worked, because naturally they can pay a little bit less for us to staff a CNA than it would be to staff a nurse. But then they're also seeing an 80 to 95% reduction in the hospitalizations, which really drives the total cost of care. The thing to remember here is the home care is only 1.6% of the cost that Medicaid pays for medically fragile children. But by finding a smarter way to improve that continuity of care, it greatly reduces the total cost of care, and frankly frees up a lot more money for other needy segments of the population that Medicaid is trying their best to also fund. So